comes to the specific treatment. For specific treatment, number first is we use osmotherapy. Osmotherapy include mannitol 20%, and it is given at a dose of 0.25 to 1 gram per kg IV. 0.25 to 1 gram per kg IV, and it should be given over 10 to 20 minutes. Or in some ICUs, we can also give mannitol via syringe pumps. And while giving mannitol, we have to check for serum osmolarity, we have to check on the serum osmolarity, that serum osmolarity should be less than 320. Okay. In patients where mannitol cannot be used, the other agent is hypertonic saline. Or 3% sodium. Okay. And it is useful in patients who face hypotension. So it is useful in hypotension, and it is given as a bolus of 2 to 5 ml per kg bolus IV. Okay. Osmotherapy include mannitol, which can be given at a dose of 0.25 to 1 gram per kg IV over 10 to 20 minutes. And while giving mannitol, we have to check for serum osmolarity, and it should be less than 320. In the patient who are hypotensive or who are on inotrope support, where mannitol cannot be used, then there we can use hypertonic saline or 3% sodium, and it should be given in a bolus at the dose of 2 to 5 ml per kg IV boluses. Okay. Now, another component is controlled ventilation. Okay. So we have to, ventilation का यहाँ पे मतलब ये है, हमें हमारा CO2 लेवल और O2 लेवल इन दोनों को ठीक रखना है. ठीक है. अगर मैं पेशेंट को माइल्ड हाइपर वेंटिलेट अगर करवा लूं, हाइपर वेंटिलेशन अगर मैं अलाउ करूं, सो दिस विल shorter the raised ICP as PCO2 levels decreases. ठीक है. अगर मैं सिर्फ हमें इतना ही रखना है, माइल्ड हाइपरवेंटिलेशन. अगर मैंने एक कंडीशन भी आ जाती है, बहुत जगह पे ध्यान नहीं दिया जाता है, whenever there is prolonged hypocarbia, समझ रहे हो, prolonged hypocarbia. So hypocarbia is a condition which can lead to more cerebral ischemia. So in controlled ventilation, we only have to mildly hyperventilate the patient, because to get the PCO2 level a little bit low, and hypocarbia can shorter the raised ICP. Okay. And if the hypocarbia state is prolonged, then eventually it will lead to cerebral edema. Another way of reducing the specific treatment is CSF drainage. CSF drainage include EVDs, that is extraventricular drain. We can surgically put the EVD drains in the brain. And surgical intervention include either if there is a hematoma or the tumor or the compressing features or the mass effect, then we have to excise it. Or we have to do a decompressive craniotomy. Okay, now comes to the last part, that is advanced method of lowering ICP. First one is we put the patient to barbiturate coma. In this, we use the agent called thiopentone sodium. Now, barbiturate coma, it will causes few things. For one, like it will eventually decrease the cerebral metabolic rate of oxygen, which eventually decrease the cerebral blood flow. Second part, it may cause hypotension. So we have to careful monitor the patient for low BP, and it also decreases the myocard. It also causes myocardial depression. And also it has some action on action like immunosuppression. Advanced method other include we have to maintain hypothermia, as hyperthermia, the demand of oxygen in the cerebellum in the brain increases, which eventually increases the cerebral blood flow and which causes the ICP. So we have to maintain the hypothermia. We have to avoid hyperthermia. Other thing we can start use neuromuscular blocking agents. Includes vecuronium, atracurium or cisatracurium, and last and final we have to maintain the hemodynamics.